Welcome to the Deep Dive, where we take a stack of information and really pull out the key nuggets.
That's the plan.
So today, we're diving into something that's, well, it's a true tightrope walk in critical care. The intravenous administration of concentrated electrolyte solutions.
Exactly. Our sources for this are detailed clinical reports, and we're here to kind of unpack the critical risks. We're talking potassium, magnesium, calcium, hypertonic sodium chloride.
Things you might just think of as minerals, maybe.
Yeah, but they're absolutely fundamental to almost everything your body does. Your heart rhythm, your nerve impulses, you name it.
It is a fascinating paradox, though, isn't it? These solutions are completely indispensable, life-saving even.
Right, for acute, life-threatening conditions.
But their very potency makes them inherently dangerous. The body just operates in this incredibly narrow window for these ions. How do we even start to get our heads around that risk?
Well, let's try to break it down. Each one plays a really distinct, vital role, but they all share this potency issue. So, potassium, for instance. Key for nerve impulses, heart rhythm. Magnesium supports like over 300 different biochemical reactions in your body. Calcium, obviously essential for cardiac function, bones too. And sodium controls blood pressure, fluid volume.
Okay, so potassium, you said heart rhythm. What makes it so critical and, I guess, so dangerous?
It's the concentration. Even tiny changes can have, well, catastrophic effects. Our sources flat out warn that direct, undiluted IV potassium is instantaneously fatal.
Wow, instantaneously.
Yeah, it leads to rapid cardiac arrest. We're talking about changes you can see immediately on an ECG. The heart's electrical trace, you go from maybe some slight T-wave changes to full cardiac arrest very, very quickly. And often it's the rate of change, how fast the level goes up, that's even more significant than the absolute number.
Okay, so it's incredibly sensitive.
More. Extremely. And this really highlights that fine line. Magnesium gives us another angle. It's crucial for nerve function, right?
Yeah.
But too much acts as a what they call a physiological calcium blocker.
Like putting the brakes on the heart's electricity.
Exactly. It directly interferes with cardiac electrical conduction. But the most immediate life threat with too much magnesium, respiratory depression, your breathing just slows down dangerously.
And calcium. Also vital for the heart, but too much.
Yeah, too much calcium can trigger severe cardiac arrhythmias, irregular heartbeats. It can make the heart's electrical cycle abnormally short. You might see that on an ECG. Plus, it can lead to muscle breakdown, kidney damage.
Not good.
Definitely not. And then there's hypertonic sodium chloride. That's the really concentrated salt solution.
Used for brain swelling, right? In emergency.
Precisely. To rapidly reduce dangerous brain swelling. But here's the catch. Correcting sodium levels too quickly, even if the initial treatment seems successful, can lead to something called osmotic demyelination syndrome, ODS.
ODS.
Yeah.
What exactly is that?
Think of your brain cells suddenly shrinking or swelling way too fast because the fluid balance shifts rapidly. It causes devastating, often permanent brain damage. A really stark reminder that fixing one problem too fast can create another delayed one.
So, okay, the substances themselves are incredibly potent, each with its own risks. But it sounds like the danger isn't just the chemical.
Not at all. A huge part of the risk is in the delivery. Precision is everything.
How so?
Well, the sources talk about systemic fragility in medication delivery. Basically, mistakes in how it's prepared, diluted, or infused can be fatal. For example, if potassium concentrate isn't mixed properly into an IV bag, the patient might get an accidental high-dose bolus. Fatal.
Just from poor mixing.
Yeah. And then there's extravasation. That's when the IV leaks and this concentrated solution gets into the tissue around the vein. That can cause serious tissue damage.
And I remember reading about a sort of hidden risk, too, something about long-term use.
Ah, right. Prolonged IV feeding, parenteral nutrition with these solutions can lead to insidious toxicities, like aluminum building up.
Aluminum. From an IV.
Yeah, trace amounts can be present. It's especially risky for premature babies because their kidneys aren't fully developed to filter it out.
That adds another layer of complexity.
It does. And connecting this all together, you absolutely have to consider the patient's own vulnerabilities. Anyone with kidney problems, heart disease, or on certain other medications, they face a much higher risk. The sources call it a multiplicative effect.
Meaning the risks compound. They don't just add up, they multiply.
Exactly. So understanding the whole patient picture, their conditions, their other meds, it's absolutely critical for safe administration. You can't just look at the electrolyte level in isolation.
This deep dive, it really shows that while these concentrated electrolytes are, indispensable tools.
Absolutely life-saving.
Yeah, life-saving. But giving them requires this unwavering, almost surgical, commitment to precision. Every step matters.
It really does. It demands constant monitoring of the patient, really strict safety protocols, and a very personalized approach. You have to know the patient, know the drug. It just underscores that understanding how these powerful agents work, their potential pitfalls, that's the absolute key to preventing really devastating harm.
Thinking about all this, it definitely raises a big question, maybe for you listening. How do healthcare systems effectively balance that immediate life or death need for these potent drugs with the incredibly complex high-risk demands of giving them safely and precisely? What kind of systemic safeguards do you think are the most crucial?